Joining us now from the Job Creators Network is their president and CEO, ALFREDO ORTIZ. And also, we're going to merge in ELAINE Parker. ELAINE is vice president of strategic communications for the Job Creators Network, and they have a new theme coming out because when we're done with knocking down statues and not being able to put but 10 people on a school bus, what we have to do is get back to work, and we have to go outside, and we have to be able to spend money and drive this economy so that we can keep up or keep the momentum going from what happened on Friday. Joining us now, ELAINE Parker and ALFREDO ORTIZ. Welcome, guys. You there?
Hey, John. Good morning. How are you doing?
Excellent. Good job. ALFREDO, I want to start with you. The Job Creators Network, you guys have rolled out a new theme, and it's called Flatten the Fear. You want to describe what that is, what that means?
Yeah, absolutely. And before anything, John, the biggest piece of news of all, what did Governor Northam say yesterday? Northern Virginia's open.
Yeah, Northern Virginia's open. Finally, right? But not Richmond. Well,
yeah, that's true. Not Richmond. But anyways, I know that you were fighting for that.
Yes, I was up there for five days straight doing that. So I think we made a difference, right?
Oh, man, of course you made a difference. Look, every voice makes a difference. And I think ELAINE Parker's on as well. I think she's just joined on.
ELAINE's on, yes.
I'm here. Good morning.
Great.
So, so let's take Northern Virginia, for instance, right? It was closed. Now it's finally open into phase 2 or whatever it is. It's ahead of Richmond where I am today, but we were up there for a week, ELAINE, and it finally opened where you can actually go in, sit down, order something to eat. But one of the biggest fears is that there'll be no demand, that people are going to continue to stay home. They're not going to spend any money. They're going to be afraid. They got to go in a mask. They don't want to be around other people. And yet the fear, the numbers, the COVID-19 numbers, hospitalizations, sick people under 65, I mean, they don't really add up. I mean, it's very minuscule. And quite frankly, ELAINE, if you're under 65 with no underlying health conditions, it's about the same as regular, normal seasonal influenza. So how do you portray that to people so they go out and live?
Yeah, so John, that's really true. There's been a perception for the last 2 months during this national lockdown that every single hospital across the country was just inundated with COVID cases. And the reality is about 10% were having a really big problem where the hospitals were overrun. We made the decision to shut down the country, but there are areas, counties in the country that have 0 COVID deaths. There are hospital workers who were furloughed, doctors and nurses who were getting pink slips instead of paychecks because they simply didn't have the issues with COVID. And now we're seeing increases in suicide and drug use and alcohol consumption and people are increasing taking anxiety drugs. And that's a result of job losses and being confined in their homes. There are a multitude of other health issues that we have to balance and look at the whole issue of shutting down this country, in addition to the economic piece of it. It's not the economy versus life; it's life versus life. And the reality is, we know that the older Americans with underlying conditions, and many of them in nursing homes, are the ones that are really at risk and very vulnerable. But if you're younger, under 65 or 70, and relatively healthy, ordinary Americans, we can go out and start engaging and living life again. And that's why we're working to educate America that we can flatten the fear, because we've done a great job flattening the curve.
All right, so define flattening the fear, and how does that translate back to the economy, ELAINE Parker?
Well, I mean, look, we've passed, several bills, trillions of dollars worth of stimulus into the economy and support, much needed support for small businesses and Americans to get through this time, a bridge back to prosperity. But we can continue, passing all kinds of bills and trillions of dollars in stimulus. But if people don't come out of their homes and actually, engage in commerce and start living and doing what we were doing pre-COVID or BC, before COVID, then we're not going to get this economy back unless we stimulate the demand side of things. So this is a bit of a change for us. I mean, we know how to stimulate, how to get the economic stimulus going, but we've got to get people out spending and living life again. And flattening the fear is going to do that. And we
John,
know a lot more about the virus now.
Go ahead.
And
Go
John,
ahead.
if I can interject for
Alfredo.
2 seconds, if you remember, we got a 70% consumer-driven economy. That was 100% shut down effectively just a couple of months ago, right? And then that fear was just stoked by the media, nonstop, as you can imagine. The liberal media, of course. The facts weren't there, right? And that's what we're trying to do. This is fact-filled. Elaine talked about some of those other mental health effects, for example. Let me add some context and numbers to that, John. 33% increase in anti-anxiety drug prescriptions. That was from Express Scripts, one of the largest pharmacy benefit managers in the country. So that probably translates to millions of new people now on anti-anxiety drugs. 75% increase in hard liquor sales. A 338% increase in calls to the National Distress Hotline. I mean, these are real numbers. These are real situations. And I think, John, you and I have talked about this before. This is a demand situation. It's not a supply situation, right? It's not only enough that we've gotten governors convinced to open up the doors finally, most of them. Now we got to get consumers out of their homes and feeling comfortable that going to their restaurant, going to whatever they were doing in pre-COVID life is actually okay to do again. And that the odds of you dying, let's say if you're less, 35 and under or 40 and under, is probably 4 times higher, right? Or 4 times less than being struck by lightning, right? I mean, this is how low the probabilities are of disastrous effects of the COVID illness. Now, the 65 and over that Elaine talked about with these underlying health conditions, they are definitely still the most exposed and the most vulnerable. We got to make sure we got to take care of them, ask them to continue staying home. But for the rest of society, let's re-engage.
Alfredo Ortiz, you're on the John Fredericks Radio Network. We're with Alfredo Ortiz. He's the president and CEO of the Job Creators Network. They have a new ad campaign, Flatten the Fear. Elaine Parker with us also. She is vice president and senior director of communications for the Job Creators Network. Elaine, I think I got that title right. Am I close?
I think you got it right, too.
All right, good. She's also the president of the Job Creators Foundation. I got to throw that in. So let's get back to Alfredo here. Is there going to be a correlation, or I'll open this up to both of you, is there going to be a correlation in the fear factor, the lower demand factor in the states that the governors continue to foment that fear and keep them locked down, like New Jersey, like New York City, where they keep stoking that nonsense? Richmond, Virginia is a perfect example. I mean, you go to Richmond, you got this mayor here. Now I'm on Richmond. First I was on Northern Virginia. They opened it up. I'm happy. Now I'm railing against Richmond. But if I go to Richmond, everybody's got a mask on, okay? Everybody. As soon as I get out of Richmond, like a foot over the line, the masks go down by like 90%. Here's an example. I go to a CVS when I get here for something. Whole store's got a mask on. Yesterday, I go to lunch in Chesterfield. I go to the Walgreens in Chesterfield. Nobody has a mask, including the clerks. They're 4 miles away. Is there a difference in geography?
I'll chime in really quickly, Elaine, and then follow up, of course. I think there is, John, and we see that, and we see it from the governors. No better contrast between, let's say, Governor DeSantis versus Governor Whitmore up in Michigan. Mm-hmm. Complete differences in terms of how they handle it. Remember, Governor DeSantis was one of the first few, along with the governor of Georgia, Kemp. To really kind of start opening up the states. Remember what they said about DeSantis in Florida, that it was going to be a disaster, and it was going to be, as bad as New York. And, he had a great team, great advice. He looked at the data. He did what he thought he had to do to make sure that he could, help the most vulnerable, but still make sure that the entire state of Florida didn't come to, a calamitous collapse there. And look where they are. They're actually doing quite well. And, he may have saved the state of Florida from a disastrous depression.
Well,
it makes a big difference.
When he first opened it up, they were saying on CNN, they were saying there's going to be, I'll never forget this, body bags in cul-de-sacs. Remember that?
That's right. Yeah.
Out and out lie. Nothing happened. In fact, these states, Georgia, Florida, Texas, Iowa, don't forget Iowa and their governor, who has been way ahead of the curve on all this stuff, Arkansas, they're leading the economic comeback. So if you're the DNC and you looked at the numbers on Friday, you got to be in a panic here. You got to be saying, well, our whole fear plan is collapsing, right?
Oh yeah, absolutely. Well, mark my words on this one, John. It's just a matter of probably a week or so before we hear from Adam Schiff again. There's going to be I'm sure some kind of hearing and testimony about, the looting and the protest and using, the military, and they're probably going to try to get him again on some kind of impeachment charge. I mean, I can guarantee you that. I mean, I just see that one coming because yes, Friday was so shocking of a number. I'm sure the Democrats didn't see that one coming. And, I'm sure now they're going to try to resort to something different.
Let's get back to Elaine. Your flatten the fear curve. This is a campaign, right? Just like we had. Remember when this started, Elaine? We had flatten the curve, and then I had Steve Bannon, who on this particular issue, we were at opposite ends. He was like, we need to smash the curve, lock the federal government down for a month or something. So we went from flatten curve and flatten and smash the curve to now flatten fear. So basically, your promotion here, your campaign, is to tell people to do a simple thing, right? Live.
Exactly, John. And the campaign can be found at flattenthefear.com. And we launched on Friday in New York Times Square with a billboard. We also had a commercial that we've run nationally on Fox. And we took out a full-page ad on Monday in the New York Times. It was an open letter to the American people that it is safe to start living and engaging for otherwise healthy Americans. And we're doing that not only through ALFREDO and I getting out there and talking about this, but we've partnered with physicians across the country who are experts in this area and can talk about the virus and help people understand how it's working and what the numbers really mean. Because when you translate it and you look at the numbers across the country, 43% of the deaths across the country are in nursing homes and assisted living facilities. And in some states, it's well over 50%. Minnesota, 81% of their deaths are in nursing homes and assisted living facilities. And in Ohio, it's in the 70s. So, when we look at that, we've got to put our resources where they're most needed instead of hurting people who may need otherwise preventative, healthy tests and things like that. I mean, I've talked to a lot of doctors, and they said cancer screenings are way down because people are afraid to go and get tests, and hospitals have been shut down, and diagnostic centers have been shut down. I mean, in the end, if we don't get this economy going and make people feel comfortable in living their daily lives, we're going to have more victims of COVID who never have the virus.
So, Elaine, you're arguing or you're presenting from logic, which I appreciate. That's one of the things I love about you. You're the logic queen. But are we really dealing with logic here? That's my question, because if you look at the numbers, like you just said, in Minnesota or Ohio, right, 70-80% of the people that unfortunately passed, souls lost, were in nursing homes. You take that number out, it becomes flu-like. Then you take out the number of people that were not in nursing homes who died that were over 85, and it becomes exactly the same as the flu. And yet we've destroyed the economy. And so, like I gave the example before, before you guys got on, our governor here in Virginia, which I live in Chesapeake, it's the biggest city in Virginia, 15 people dead, 10 of them in a nursing home. Means we lost 5 people. My son can't go to school in the fall. I mean, what's like what? The 5 people, and only 2 of those 5 under 65. So Chesapeake has lost 2 people between 55 and 65 out of, I don't know, hundreds of thousands we have, biggest city in the state, and we can't go to school. So is that based on logic? What is that based on?
John, we are the most polarized country I've seen in years. I mean, in decades. We're so polarized. There's no doubt, like Alfredo said, there are states and governors that have kept their states shut down, and it isn't logical. So, what we have to do is focus on the areas geographically where people are receptive to the message and they want to hear this message and they want to be given permission to go outside and start living. And eventually we'll hit a tipping point. Those other states are going to start to want to compete and be outside as well.
Mm-hmm. And John, if I could add to that, I would actually probably even take a little bit of a different twist to that, is that I think it's selective data being fanned by the liberal media that is leading to logical reactions by Americans where they're listening to that message. Logical being that they're listening to selective bad messaging from the liberal left, right? So they're logically afraid, right? So I wouldn't call the American public illogical in this particular case. They're actually being very sound in their reasoning because they listen to that one-sided approach, right? Only. And that's why I think we've got that demand issue and people are afraid to leave their homes. So the tough part here is that the real information, the data that Elaine was talking about that I just mentioned, right? That is the stuff that needs to also get out so that Americans can make their own decisions. And that's what I think we're really advocating for here is get all the data on the table, get all the facts on the table, and let you, the American public, make your own choice and decisions about whether you want to wear a mask or not wear a mask, right? Based on the data, based on the odds of you dying from COVID. Mm-hmm. And that's what we're saying is that, because again, I don't want for people to think that we're calling the American public illogical or irrational. Mm-hmm. Again, when you look at what the media is...
It's the messaging that they're... the one-way messaging in these states that they're responding to.
That's right. And so that's what we're trying to do. We're trying to get all the data out there and the messaging that says, listen to the other side of that coin, because we've also got doctors that say, look, guys, it's actually okay. Again, the odds of you dying, if let's say you're 35 and under from COVID, right, are 4 times less likely than you being struck and dying from lightning, right? I mean,
it's yeah. I mean, that's why I think your ad campaign, which we're gonna talk a lot more about tomorrow, Flatten the Fear, is so important that you get the facts out to people and then they can make their own decisions. Because right now, if you just look at a simple thing like masks, and there's a lot of controversy over this because the WHO just came out a week ago Friday, and said they do more harm than good to healthy people unless you're around somebody with COVID. Like, don't wear it. You'll get sick. It's like worse. Okay, so that's, I mean, CBC says something else in the WHO. So there's a lot of different information. But if you do polling on mask wearers, I mean, this makes no sense to me. 85% of Democrats wear masks, 10% of Republicans. So, I mean, when you talk about messaging coming from various government partisans, why do 85% of Democrats wear masks, but only 18% of Republicans wear masks? How does that work? Either it is helpful or not. Alfredo.
Yeah, no, that's right. I mean, and I think that is that stark difference. I think you and I have actually even talked about this. You go to Trader Joe's. I love Trader Joe's, by the way. But it's interesting. You got a lot of folks who probably tend to be a little bit more liberal that shop at Trader Joe's, actually. I'm not sure if you're aware of that or not. And you see them, they're all wearing masks, right? But if you go to another location that tends to lean the other way, no mask there, right? I mean, again, it's this balance of data, right? And first of all, as Americans, we all work together to do what we had to do, right? We did flatten the curve, and we have to remind everybody that the reason was not to get rid of COVID, right, and that virus. It wasn't to eradicate it, but it was to make sure that our healthcare systems weren't maxed to the point that we were going to have bodies in the streets outside of hospitals. We achieved that, right? Mission accomplished on that particular objective. Now the objective is we've got 40-plus million Americans who filed for first-time jobless claims. We had a great unexpected jobs report on Friday, which is great, but still we've got 85% of the people who are unemployed that became unemployed over the past few months because of COVID, right? It wasn't systemic recession, so to speak, that we're confronting now. It was really a situational recession caused by that disease. We got to get everybody back to work, right? Everybody's got to get back to work, and we've got to get back to the unbelievable economic success that we were having in February. I mean, remember, just a few months ago, right, John? 3.5% unemployment. We had 7.5 million unfilled jobs, right? This economy was rocking, and it's because it was rocking that we actually, I think, have rebounded so nicely to where we are today because the patient was healthy going into the sickness, right?
Well,
and so,
yes.
so that's the best part.
So if you're Alfredo, Lynn, I know we're out of time. You guys got a hard out at 6:50, so I got to go. But if you're the Democrats and Biden had a press conference scheduled, a Zoom call, whatever he does from his basement, scheduled for 12 o'clock on Friday. They canceled it. You know, they were going to blast the economy because they expected another 7.5 million jobs gone. We added 2.5 million. So if you're the Democrats now, all these governors, I mean, you're looking at these numbers, you're like, oh my God, the recovery they're talking about is going to come and we're all going to lose. So now I'm thinking to myself, I'm petrified. I'm thinking, what else are they going to do? I mean, they've tried everything. You know, now the economy's coming back, and the only thing I can think of is keep kids out of school, because if your kids aren't in school, you can't go back to work, right? I can't think of anything else. What else are they going to do? They're going to do something.
That's a big one. And again, you know, I wouldn't be surprised if you see Adam Schiff's face in the next week or so here.
Of course.
John. You know, I see that one coming.
Look, we're out of time, and I appreciate it. But look, the Job Creators Network, Alfredo, ORTIZ, and ELAINE Parker, you guys have been ahead of this curve from the day one. And by the way, a lot of my friends on our side of the equation here were wrong. We were right from the first day. We were on target with this thing. It's a completely political agenda, and I think the lockdown across the globe is going to go down as one of the stupidest things that's ever been done in history, ever, because there's so much evidence now saying the lockdown had no impact on anything. Unbelievable. We destroyed all these jobs. And I tell you, Alfredo and ELAINE, every time I drive by a store for rent that says for sale, for rent, or out of business, it breaks my heart, because these are stores that I've gone to and I've seen, and yeah. I knew the owners, and it's just horrible and so sad. But ELAINE's in good shape because she lives in Florida. Alfredo's in great shape because he lives in Atlanta. He lives in Georgia. So you guys are rocking. It's the poor schmucks like me that live in Richmond and Virginia, and I can't send my kids back to school or play baseball in the fall. We're the ones that are getting screwed. So maybe, ELAINE, I should come to Florida.
It's time for you to move.
I know. That's what I swear to God, ELAINE, Ann said the other day. She said, you know what? If Joseph, as soon as he gets out of high school, we're going to Florida. we're going to Florida. Man. I said, well, okay, we're going there for a tournament at the end of July or something. She's like, if he was out of school now, or if we didn't own businesses in Virginia, I just move there now. That's what she said. Like, just sell the house and go. Unbelievable.
All I can say, John, is DeSantis and Kemp are going to have to flip for you.
I know, right? I wish you were there. Hey, guys, thank you. ELAINE, we're going to have you on again tomorrow. Go to flattenthefear.com. Thank you for your time. Oh, I'm over the time. Flattenyourfear.com. I'll be right back. Stay with us.